Welcome everybody to our summer learning series. My name is Michael Charron. I am an assessment and technology consultant at Pearson Canada Assessment. I'd like to welcome you to today's webinar, which is supporting student mental health at home and at school. As we and our youth are really in the midst of a very challenging and ever-changing time, having some solutions to provide support in different ways in this new reality, it can bring some efficiencies as well as some better care. Now, establishing these guiding principles and strategies really helps us ensure that we're providing the best care possible. For today, I'd really like to highlight some of these goals and priorities, and then walk through a model that would help us really follow through on these particular needs. So this model is known as the SAME model, which will then follow through to further explore each one of the levels within this model, which would be screening, assessing, intervention, as well as monitoring outcomes. And we'll finish up with some referencing towards consultative services and how we might be able to help further. The VIPs, or I guess VIP of Canada. Who are those? Well, those are very important people of Canada. Again, really, we're all here today for our children, our students. They are, of course, to us, the most important people of Canada in our lives. However, all of you, to me, are very important people. You're the ones who are caring for not just our students or children, for our peers or elders, from educators to psychologists, speech language pathologists, occupational therapists, special educators, therapists, parents. We are all, this may be overstated these days, but we are truly in this together. And the more that we are in this together, the better outcomes, the better life that all of us will have. So again, thank you very much for what you're doing, and any way that I can ever help out to help you help others, please let me know. It's a privilege. So let's talk about these goals and priorities a little bit further. Now, I'm sure that many of you have read many articles, had a lot of conversations, and set plans to support mental health and behavior in our schools and our school boards and districts. Now, some of the articles did catch my attention, and there's one that I really kept an eye on for updates, for I guess just looking for best practices and a really well-supported article or information. And I'm gathering many of you have also read this. There are friends at the Hospital of Sick Kids in Toronto, Ontario, have provided a recommendation, a document for recommendation towards school reopening. And they've updated this resource a number of times. And really what these recommendations are sharing are research and best practices based perspective on many points of consideration towards returning to school. Now, 2 points that are related to assessment and supporting the mental health and well-being of our students. So I'll just quickly highlight these points. If we take a look at, I've listed 1 and 2. However, in the article, there are points 9 and 10, and it really speaks to the need to focus on our urgent, complex needs, our students with these urgent, complex needs, as well as that ensuring that all of our students are supported. Now, my hope today is really to share strategies and solutions to help you meet these not just important, but essential goals. Now, as I mentioned earlier, there's a model of support called the SAME model. And this model really, it supports all students. And what it also does is that it helps provide that equity, that almost triage approach towards providing the needed care to each and every student. So as a reminder, the SAME model relates to screening, assessing, say comprehensive assessment, intervention, and monitoring. Now, some people have put the E at the end for monitoring evaluation or monitoring outcomes. It's really, it's progress monitoring, or again, monitoring the effect of our interventions. Now, as distancing measures and remote services are really important considerations and factors right now, I want to present solutions that are digitally available. Now, with the SAME model, I will be presenting some screeners. And again, the screeners are intended to, again, support all students, to be able to monitor and have touch points in a really brief, efficient way, but that allows us to, again, keep an eye on all of our students. From there, we're able to identify what students may need more in-depth assessment, more comprehensive assessment. Now, there is also those urgent cases that come up that we will also need to focus our comprehensive assessment approach to. Now, this allows us to generate a profile of strengths, of areas where the student needs particular help or assistance. And within these are also supportive analyses to allow you to better understand the individual and their individual needs. And from the intervention perspective, there are different tiers that we're able to leverage for intervention. If we want to look at this, a three-tiered model where our tier one is all of our students. So we are able to put in place strategies, some initiatives that will really help all of our students with their, in this case, their mental health and their behavior, their well-being. Our tier two strategies are typically for those struggling students, maybe those that we've done a comprehensive assessment with or that are in particular service programs, that these are interventions that would be more specific towards their areas of particular need. And then with the tier three interventions, these are for the students that are urgently needing our support. And they are typically individualized and very comprehensive intervention programs that include maybe a number of strategies, as well as then leaning into that monitoring step, which is really, the monitoring can also be done in that tiered organization, and really this year, not just this year, every year really, but it's in the students' best interest that there be this monitoring perhaps 3 times a year. People in the academic world might call it benchmarking. It's really touch points throughout the year to ensure that our students are faring well, that their behavior, that their mental health is doing well. And by checking them maybe in the fall, winter, spring, that allows us to keep an eye on them. Because at certain times, if you're to monitor students in the fall, well, there may be certain events that have occurred in their life between the fall and the winter that they, at that point, may need some additional support. So that's where it's really important to look at that tier 3 monitoring, which can be done in screening, again, which is very efficient. For also monitoring, obviously we will be looking at those tier 2 students, those struggling students, to ensure that the strategies that we're putting in place in the intervention step are effective, that we see progress, and that we hopefully help them address those issues. And if we aren't seeing that improvement, it allows us the opportunity to change things up and try another strategy. It's very similar with our tier 3 students for monitoring. It's really looking at those specific goals and treatments and looking at the effectiveness of those and really hoping to see that rate of improvement increasing and showing effectiveness. So now what I'd like to do is really go through each one of these different sections of the same model. So we'll start off with screening. And again, as I mentioned, I'm providing some suggestions, recommendations that are digitally available, because really, again, looking at distancing measures and keeping things clean and sanitary, this is by far the best way to do that, to really support that. So within our screening, I have three programs, three solutions that Pearson develops that are really outstanding and that are focused on exactly what we're needing for behavior and mental health. I'd like to start off by sharing a bit of information about Review 360. Now, Review 360 is a web-based platform, and it really is amazing in the sense that it encompasses, it's almost a turnkey solution for mental health and behavior. It integrates screening, progress monitoring, staff, professional development, but just within the screening model, because I'll chat about that a little bit further on as we're talking about the different layers within the same model. But it really stands out with Review 360 is that it includes two gold standard screeners, which are the BASC-3 BESS and the SSIS Social Emotional Learning Screener. And so both of those, which I'll talk about in just a few moments, can be used independently. They are their own assessments. However, Review 360 includes them within its digital web-based platform. Now, what's really neat about this is that you're able to deliver these screeners to the teachers and to the students, and then you'll get real-time reporting and results, and it is very easy to interpret. It's easier to interpret because all the data is right there. It's presented in graphs for you, and you can look at, because it's all, the reporting, the data is automatic, you're able to look at different levels, be it at classroom levels, grade levels, school levels if needed. And this really, it makes it very user-friendly, that everything could also be scheduled to deliver at certain times. And really with the screeners, that BESS and the SEL screener, it will help identify students that may be having externalizing behavior issues, internalizing issues, which we may be seeing more internalizing issues come this fall, see anxiety. It also helps with looking at those internalized and externalized, I mentioned that, but also the social emotional learning and adaptive behavior. Now, Review 360, as I mentioned, it's the web-based program. It is its own platform that houses the BASC-3 BESS and the SEL screener and a lot more, which I'll get into a little bit later. Now, the BASC-3 BESS, it's the Behavioral Emotional Screening System. That's what the acronym stands for. And this is its own assessment family, the BASC-3, and part of that is the BESS, again, the screener. And it is available on our web-based platform called Q Global. I'm sure many of you are familiar with Q Global. You're probably familiar with the BASC-3, but you may not have heard about the BESS yet. What the BESS does is it has pulled out the most salient correlating items with the overall relevant scales for looking at externalizing, internalizing, and adaptive behavior. After you've administered, you'll be able to generate an overall score, a behavioral emotional difficulties index, and then it'll break it down into the externalizing, internalizing, and adaptive behavior. Now, with the best forms on Q Global, you have the student teacher and parent forms that are available. And again, with this, you can actually email it out to the teacher and the parent using Q Global, as well as the student. The next screener that I'd like to share with you is the Social Skills Improvement System Social Emotional Learning Screener. This is from another system called the SSIS-SEL. It's authored by Frank Gresham and Stephen Elliott, who are really well-known, well-respected researchers in social emotional development. And if you look at, I think CASEL would be one consortium for academic and social emotional learning. The SEL rates very highly, and it's another amazing system. Now, the screener itself, it's a teacher rating scale, so it's really quick to do. The teacher would have to have some experience or some time with the students before doing the ratings. However, it allows the teacher to rate on self-awareness of the student, self-management, social awareness, relationship skills, and responsible decision-making. Now, this is on Q Global as well. And for this, the teacher would essentially have almost like a Likert scale rating that they're rating each one of these areas for each one of the students. So it's a quick way to really keep an eye on some of these important social skills. Again, especially with everything that's going on. So we've taken a brief look at some of the screeners that are really highly relevant to our student mental health, behavior, and well-being. Now we'll take a look at a few assessments that help us really further investigate those particular needs with students who are struggling in those areas. Now, the BASC-3, you're probably familiar with that from that last slide, or I gather many of you are using this as well. Now, the BASC-3, the Behavior Assessment System for Children, 3rd edition, it's a comprehensive, what I call broad-based assessment of behavior, mental health. And it's essentially a rating scale that a student would complete, a parent, and a teacher. And it's best to have all three raters so that you get a good perspective of that student's potential areas of need. And it'll include subscales, or some of the main scales are externalizing behavior, internalizing behavior, and then adaptive behavior. And then in each one of those areas, it further breaks down, has additional subscales. Let's say for externalizing, we're looking at hyperactivity, attention. Internalizing, we're looking at somatization, anxiety, depression. The adaptive behavior is looking at things like functional communication, leadership skills, and so on. So it goes further in depth, and then it even gets even more in depth. It'll have probability index or clinical scales that look at, say, autism probability, ADHD probability, and so on. And then there's even an area that looks into executive functioning and then breaks that down as well. What's I find very helpful with the BASC-3 is that there's a report that you can generate that includes interventions. And those interventions they're evidence-based interventions, they're best practice. And in the report, it includes these intervention recommendations based on the severity of the issue, which is based on the elevation of T-scores. And then it lists it by primary areas of concern. And it lists a number of strategies, and then by secondary areas of concern. And then it'll even highlight some of the behavioral strengths that you can leverage when you're planning any type of intervention program for the student. It also links to the DSM-5 at the end. So if you are looking for diagnostic support, it'll provide some additional guidance. Another comprehensive assessment, and this one here, it's called the Beck Youth Inventory, 2nd edition. It's a group of inventories that are focused on specific areas of need. There is a depression inventory, an anxiety inventory, an anger inventory, disruptive behavior, and self-concept. So each one of these can be either administered independently, or you can administer them all to have a good profile of these specific needs. Typically, a 3 would be used first. And then if we are seeing elevations in these areas, then you could follow up with a Beck Youth Inventory for corroborative evidence or for more specific symptomology, symptom identification. And again, this is on Q Global. Everything that I'll mention today is available digitally. And now with the Beck Youth Inventory, this is only student completed. We're not getting the rating from the teacher or the parent. This is focused on that individual. The next assessment is the MACI-2, the Milan Adolescent Clinical Inventory 2. And really, this is a very clinical, therapeutic measure that will help you really get an in-depth understanding of any type of mental health needs. So it does really has a focus on personality, on mental health and behavior. The way that it's set up is that it is a self-completed form rating scale, and it'll look at personality patterns, express concerns, and symptoms that are clinical in nature. And that allows you to get a really, really good profile of that individual's, that student's area where they are needing support. And within one of the reports that's available, the interpretive report, it provides the option to integrate the results with current best practice therapeutic focus. And then it allows you to link it to very personalized treatment. Again, this is one that, let's say that you started off with your BAS-3 and you noticed that there were some issues with any mental health issues. I'll pick on the anxiety. And the MACI-2 will really help you focus in on that to look at, between stress and worry, perseverating on certain issues, and allow you to, again, have a better understanding of where you should focus the therapeutic treatment. The last comprehensive assessment that I wanted to mention, and that many of you probably know and use quite often, is the Vineland-3. It's an adaptive behavior measure. It is typically completed by a parent or a teacher, or even in an interview format. Now, a lot of people are using the Vineland, and typically it is used for diagnosing ID, using it with DD, but also with a number of other students that may require support in their integrating into the community or within the environment. So again, they're adaptive skills. And the Vineland-3 could be especially helpful during these times where some of our student populations may benefit from updated evaluations of their adaptive functioning. I'm thinking maybe some students may have been identified with ASD, that within this new environment, it may be nice to really get a current perspective on how they're adapting to their different environments. Where may we be able to add in some additional supports or plan around that? Now, if you're looking just for the diagnostic piece, the Vineland-3 has two forms. One of them is a shorter form called a domain form, and it'll be sufficient for diagnostic purposes. But for that planning, intervention, getting those supports, that's where the comprehensive form is very helpful, because then it looks not just at the domains of adaptive behavior, but it looks into those social domains. So let's say for communication, we'll get into that receptive, expressive language. So it allows you to further investigate where those supports may be needed. And there's also the ability to look at monitoring the performance using the Vineland and a number of tools. But I think that's a step away from our next one, which is the intervention supports. We have a lot of intervention supports. I'm just going to say the best one is really the Review 360, because it encompasses everything from our BASC and our ISSCL plus a lot more. Let me just focus a little bit on the Review 360. Again, I mentioned it's web-based, and this includes, as far as intervention, there are intervention strategies built into Review 360 that you select from for general populations, but then even for specific student populations. Let's say that There are modules for autism, for ID, for LD, for those students. So there's specific interventions, best practice, evidence-based interventions for these particular groups of students. There are also general strategies to help address mental health and behavior for all students, looking at initiatives, school-wide initiatives. They are implanted in Review 360, and all of the, let's say, the professional development for the staff on all of those areas are in Review 360. It helps with the strategies for the students, but it also augments the staff capacity to help with these different issues, to understand what anxiety is, what are the antecedents to some of these behaviors in these particular areas. And because this is all web-based, people can access these from, if they're working from home, if they're at a school, if they're at the board office, wherever they are. And it allows a consistent approach so that everybody is gathering this information, these strategies from the same place. And when you're doing that, I guess I'll talk about that in the monitoring, is that all of the information is going into the same place. People, the relevant people, will have access to be able to see that information. Now, there are also functional behavior assessments in Review 360. And again, the report generation in here is phenomenal. It'll actually drive your behavior plans for any students with behavioral issues. It essentially, from start to finish, it will take care of all of the different areas of needs. Now, the BASC-3 has two intervention resources that I wanted to mention. One is it's called the Skill Building Guide, and it's a manual that is available digitally on Q Global, and it's intended for classrooms or small groups of students. It provides a number of strategies to be able to help with externalizing issues, internalizing issues, school problems, or even adaptive behavior. It'll have some workbooks and resources for it. This would be good if, again, for whatever reason, if you couldn't use Review 360, this is a nice way to get some of those strategies, those initiatives for our groups of students. That really, these are essential skills right now, and skills that we want to be keeping an eye on. The other part to the BASC-3 is, I call it the BASC-3, the big one. So I'll play on words because it's the Behavior Intervention Guide. Everything in my world is acronyms, so I gotta have a little bit of fun with it. So the Behavior Intervention Guide, it's a big manual, and the intention of this is really to have strategies for one-on-one or individual interventions. So maybe those really high needs students. So what it'll do is I've listed all the different areas of intervention, and it'll have a number of strategies in each one of those areas. And it'll even talk about some of the Tier 1 strategies that you can do. So for all students, looking at maybe academic problems, or the Tier 2, but really a lot of the focus is for those Tier 3 students, that really high need students. Next, and this is again available on Q Global digitally, the SSIS, social emotional learning, it has a class-wide intervention program, and this is really neat, but you need small groups of students. And I will say this is a turnkey solution for social emotional learning skills, because what it is it's a program that has about 23 to 25 units, and most of them, I'd say about half of them, are actually in a PowerPoint format so that you can deliver it to the students that way. And it really looks at these areas of self-awareness, self-management in all of these units, but it breaks it down into the specific skills. And I guess the format is that the teacher would tell and show how to do these particular skills, and then they would have the students do those skills and practice them, self-monitor, and even generalize them. Very effective program. But again, it's part of your Review 360 as well. But for whatever reason, if you're not able to implement Review 360, have a look at these, because these are part of that Review 360. Last but not least is monitoring. Again, people sometimes put an E at the end for monitoring the evaluation, monitoring the effectiveness, monitoring outcomes, progress monitoring, but we're monitoring, we're keeping an eye on things. Now, evaluating outcomes, monitoring. Within Review 360, the easiest way to monitor is using 360. And I almost like to say that Review 360 is looking at 360 around that student. So it's looking at them, but it's also taking into consideration the school environment and perspective and the home environment perspective, so that you're able to get the feedback from the teachers, the parents, the student, all encompassing. And within the monitoring, all of these points of screening, assessment, even intervention, progress monitoring, everything is reported. It's automatically available because it's all online. And again, that's where you're able to see those trends. You can look at the student themselves to be able to see the improvement. You're able to look at grade level improvement, class within a grade, school. So it allows you to monitor the effectiveness of your school initiatives, your student group programs, and your individually administered interventions for those high need students. And the communication is phenomenal because it allows everybody to access, everybody that's caring for that student, to access the data and to be part of that team of support or care. Now, the BASC-3, there's, again, as I mentioned before, it's a family. You saw that screener, a couple intervention guides. Now, there's something called the Flex Monitor, and this is pretty neat. It's on Q Global, and there's student, parent, and teacher forms. And you can either create a customizable form by selecting the items from the BASC-3 that you want to monitor within that student. Or you can choose standard forms that are already built for internalizing, externalizing, or disruptive behavior, ADHD, developmental social problems. And again, with Q Global, you would be able to send that out, be able to then generate a report to be able to investigate the effectiveness of those programs. Next is the SSIS SEL Progress Monitor. And really, it is the same as that screener, the SSIS SEL screener, that the teacher would rate each one of these areas. Now, the main difference is that it enables and allows the teacher to rate other areas. So for reading skills, math, and academic functioning. But it's essentially, they're going to be rating from 1 to 5 each one of these areas for each student. Now, we went through quite a bit today, and I noticed that I was actually probably speeding up as I was going along because I was being mindful of time. And I just see down here social workers were not on the list. I thought I did put them on the list, and they should be on the list. I apologize. I think I had the 3 dots, but I thought I put them in there. My apologies, because absolutely, they are on that list of very important people. My apologies for that oversight. And let me take a look here. Oh, the consultative approach. Sorry, I got a little sidetracked there. First off, I mentioned earlier our team. We have a team of consultants, or assessment technology consultants. I'm one of them. I'm providing support for folks out in Ontario and Manitoba right now. And then again, I have my colleagues that support the rest of Canada, both en français and in English. So feel free to let us know if we can help out in any way. Really what we'll be able to do is work with you. If you want to look in more in depth into any of the solutions that we talked about today, we'll be able to show you the program, actually demo it, go in there with you, chat with you about what areas may be the most important areas that you want to focus on, or that your board or your school needs to really build upon. We'll help you make that decision to figure out what's going to be best for you, or essentially we'll be able to provide the information so that you can make the best decision. And it's not just at the start that we'll be able to help. If for those of you who know me, we're here to help out all along the way, from implementing and then the ongoing support. Really what we're doing, we take a lot of pride because we feel it is a privilege to be helping you. And as I mentioned from the start, it's I don't know, for me, it's my little way of helping in the big picture. So any way that I can do that, I'm up for it. So now's the time that I'm going to take a look at any questions and see if anybody has any questions that they'd like to ask. But this is my contact info. If you don't have it, my first name dot my last name, michael.charron@pearson.com, my phone number, and feel free to reach out to me. We also have our other consultants. If you follow that link, you can, if you're from BC or Alberta, we have Samuel Pierre Rousseau. From La Belle Province de Québec, we have Pierre Choquette. And then the rest of Canada, well, I guess myself is Ontario, Manitoba, and the rest of Canada is Nadira. So let's take a look at these questions. Is the SSIS available in French? Désolé que non, it is not available in French. Now, I can maybe help a little bit. There is the Basque 3s in French. I know it's not the SSIS, but there is that adaptive behavior. You can look at some social skill indicators. What tools and resources does Pearson have to help professionals get started with telepractice? My go-to first for telepractice, Q Interactive and Q Global. Q Interactive is a means to administer 2 assessments via iPads. However, you can actually connect those iPads to your computer and deliver it remotely. Q Global is a web-based platform that you can leverage digital versions of your STEM books, email questionnaires, or rating scales. So really a combination of having those 2 platforms, Q Global and Q Interactive, that would be my first step. And also, we have a telepractice webpage on our website. So if you go to our main webpage, pearsonclinical.ca, very similar to what you see up here with the assessment consultants, there will be a telepractice page that you'll be able to access. It has just so many resources for best practices, research, guidelines, what's available. We'll all be able and happy to help you with specific questions or demos for Q Interactive, Q Global, and for Review 360. And, through Review 360, it'll be helpful for, I don't know about telepractice, but it'll be helpful for going paperless, especially in a school board or school. And yeah, again, it'll really support using best practice evidence-based interventions. Are you able to provide a demo of Review 360? Yeah, absolutely. And then it says, who would I contact to arrange that? If ever you want a demo for Review 360, and actually I'd recommend that if you're interested in Review 360, or any of those points from the professional development to the screening to the behavior intervention plans, let us know, because we can actually show you, go in the system with you and do a tour. And it's really impressive, and you'll see how that it's very intuitive, very user-friendly. Yeah, it's just a great program. So reach out to us. You can reach out to me, and I can either help you out or can direct you to one of my colleagues. Let's say if you're in BC, well, I'll share your info with my colleague, Samuel. Just going to take a look, see if we have any other questions. The BAS 2. Oh, that's a great question. How does the BAS 3 self-reported personality compare to the Beck Youth Inventory? So the BAS 3, it's more broad-based. So you're going to catch much more than the Beck Youth Inventory. I think that more in the adaptive behavior section, that's where you'll see more in the BASC. But with the BASC, again, being a broad-based measure of behavior, I would start with that. And then if I'm seeing, let's say, depression, anxiety, somatization, or even aggression, I'm going to follow up either with the specific Beck Youth Inventory, let's say the disruptive behavior one or anxiety. I'd follow up with that again for cooperative evidence, but also to look at symptom manifestation. It allowed me to get just more data points. The Beck Youth Inventories, they're quick. They're about 20 questions long, but then they're each in those individual inventories, let's say. If ever you would like, I can actually share sample reports for all of these as well. So if anybody's interested, email me and ask me show me some sample reports between the Basque and the Beck youth, and I can show those to you. So it might help you make a decision. And then any other question, be about psychometrics or anything, let me know. I love assessment questions. How does same model screening particularly address anti-Black racism and potential for bias related to racism, other forms of marginalization? It's actually a really good question. Has this changed given recent events? To me, the same model, especially the screening, is really important for that equity, because rather than, and I'm not putting this on anybody, a teacher or anybody, rather than somebody identifying students and saying, hey, they should be tested, this allows you to be objective by saying, I'm testing everybody, screening them, and it's based on the numbers, based on the elevations of these scores, that those are the students that we are going to help. It doesn't matter what their name is, what their race is, what their gender is. It's about the elevations. It's being objective, data-based, data-driven. So to me, this is supporting that in such a great way. Like even the marginalization, by looking at helping all students, giving them the opportunity, those touch points for each student, that's what's addressing that. And we have other solutions for academics that do the same thing. Review 360, well, actually all of those tools that I mentioned would do this. Review 360 would make it easier, but we even have an academic program that would do the same. And it's something that, I advocate for. It's more of a system. It's always best at a system implementation, because if you're doing that at a school, then what about all those other schools? So ask me if you'd like to learn more, or, even just chat about this. I'd be happy to, because there's some really helpful tools out there that would really drive that. So right now I'm going to have to wrap up just because I'm mindful of time. Please do reach out to me at any time for anything: assessment, intervention, progress monitoring, screening. Any way that I can help out, again, is how I can help you help those students who really, those are our very important people of Canada, and so are you. So thank you, everybody. Really appreciate your time and what you're doing out there. Wishing you all the best. Thanks again.